Welcome back to The Price of Business. I'm your host, Kevin Price, talking to you about you and your business. As you know, I'm doing a lot of series of articles on topics related to, some of the biggest challenges that business-to-business companies are facing. Ron Brown is with the company COO of a company called OnceLogix, a minority-owned and operated software company that specializes in web-based solutions. And we're glad to have you on the program today, Rob. By the way, where are you all located?
We're based in Winston-Salem, North Carolina, and Winston-Salem is a small tobacco town, not Silicon Valley. Okay,
very good. And tell us about OnceLogix. It's exactly like it sounds, OnceLogix.com. Tell us about OnceLogix.
OnceLogix, we're basically a software company, and we develop B2B software solutions for different industries. Our flagship product is ShareNote.com, which is an electronic health record system designed specifically for the behavioral health care industry.
Okay. And behavioral health care, that would be anything from like therapists to maybe even rehab centers, kind of give you a scope of the type of companies that you would work with.
Absolutely. And you nailed them. You hit them right on the head there. We work primarily with folks that provide mental health services, like therapists, psychiatrists, psychologists, also people that provide substance abuse services, licensed substance abuse advisors, as well as counselors, and then also people that provide developmental disability services as well.
Okay. Kind of tell us exactly what your products entail.
ShareNote.com basically is a practice management tool. It manages every aspect of a behavioral health care organization's company. It manages from the time someone walks in the door until the time they're discharged. It manages scheduling. It manages that agency's entire workload, all of their data, all of their documentation, keeps track of all of their patient charts as well as their staff personnel records. So it's a tool that pretty much manages and automates their entire process.
Okay. And what's the old paradigm? How have people done this historically?
They used to do it just by paper. When they met with someone and they had a counseling session, say, for example, they sat down with that person and they wrote out all of their notes. They have to typically, when they meet with someone, the evidence that met with that person is their progress note or the documentation that they did with that individual. They also use that as their receipt to bill a payer, some type of insurance company, be it Medicaid, Medicare, Blue Cross Blue Shield, or some other type of healthcare or health insurance company. So that documentation is very, very crucial to not only the patient care, but also to the financial side for that organization. So you can imagine, a lot of times that documentation was illegible. A lot of times it disappeared. God forbid a fire or a flood or a disgruntled employee would, sabotage patient records and charts. And so now it's all electronic. And, more importantly, it does all those things, but we create we're a key part of that agency's disaster recovery plan. So anytime they have any information, any data, any documentation that they need to recreate in the event it was destroyed, they can do that by using our system, retrieving that data and that information out of our system.
By the way, the article at priceofbusiness.com is about your biggest B2B business challenge. You're saying here that, one of your biggest challenges is that you initially went after major companies, but you quickly realized that you couldn't compete with the larger electronic healthcare record agencies. Why could you not compete?
Well, we couldn't compete initially because, number one, lack of knowledge. The learning curve, we stumbled into this business. The learning curve was pretty tremendous, and we've overcome that now. Also, just the law of first, the first person or the first people to to get to market. Typically, they're gonna be the strongest player. Like, Coke will always be bigger than Pepsi because they were first, as long as they don't do anything to screw up. So the law of first kicked in. So there are a lot of other players also that work with the larger hospitals and larger organizations, and they had reputations of doing that, and we just didn't have that. So what we did was we found a sweet spot. We found agencies that were smaller or medium-sized that the larger electronic health record companies weren't talking to. I mean, literally weren't talking to, simply because they were smaller. They were agencies that were billing anywhere between $2 million to, say, $10 million, where the larger organizations might be billing anywhere between $20 million to $100 million.
Right.
And so let
me ask you: is your product comparable? Is it competitive to the larger companies?
Absolutely, it is. And what we're finding now, what we're seeing now, is we're able to move up market. We're able to move to those larger organizations now at this point because of our reputation. Because nobody can say we've had over 400 agencies use our system. No other electronic health record company can say that. Now, we've had over 400 small to medium-sized agencies use our system, and now we're creeping up that ladder, and we're seeing larger companies start to use our system.
Yeah, very cool. How do you bill for your services?
It's a software as a service, so people pay for seats. They pay for licenses to use the system, and they pay us every single month.
And you have a license for each user.
Exactly.
And I would assume the larger the organization, you probably make almost a volume deals and that type of thing. I would assume.
Yeah, exactly. And we tend to do that with some of the smaller companies. And a small company, we have people that use our system that have 2 employees. We have people that use our system that have 250 employees. So yeah, we tend to scale it back when we get to the higher numbers, the larger numbers.
Very good, and very interesting. And so, love to hear your story. And how old is your company?
We're 9 years old. We'll be 9 years old in this August.
Well, I'm so glad you took some time to participate in our article at priceofbusiness.com and visit with our audience today. And Rod, what exactly is your role in the company? You're CEO. Are you CEO?
No, I'm the COO. I'm the coup. The chief
You're the coup. So the CEO better keep an eye on you.
Exactly. The CEO better keep an eye on you. Now, we're actually...
all right, Rod Brown, CEO. Chief Operating Officer for OnceLogix.com with a cool name, OnceLogix.com. Rod, thanks so much for your time.
Absolutely. Thank you. I appreciate it.
That wraps up today's program. Do want to remind you, best content here, you know where it shows up, over there at USDataReview.com. While there, make sure you like it on Facebook, follow it on Twitter. This is the Price of Business.